to EBCI's response to COVID-19. This morning I received updated information from health officials, including Cherokee Indian Hospital CEO and our Public Health and Human Services Secretary, that the EBCI has received confirmation of our first positive case of COVID-19. The individual is a part-time resident residing on the Qualla boundary. Given their resident status, this case will not be counted as a North Carolina case. This individual has been in isolation at their residence on the Qualla boundary since the onset of their symptoms and will continue to stay there. At this point, we will take questions from Scott McKee, who's representing the Cherokee One Feather.
What information can you release on the patient?
I'll defer to public health on that.
At this time, as with any communicable disease, we cannot release personal identifying information about the patient. What we can say is that the patient is at home following isolation orders and is doing well at this time.
Thank you. Can you describe the testing process and what all is involved in that?
Sure. Essentially, following the state guidance for testing, patients who are suspected as being COVID positive would come into the health facility, and the test is just a very quick and basic nasopharyngeal swab where we place a swab in the patient's nose. The test is sent off, and it's taken about 3 to 5 days to get the results back.
Okay. What happens to a patient after that initial testing, and what is the protocol if a patient happens to test positive?
So the protocol is if someone is confirmed positive, we have a relationship with Swain County Health Department. They have jurisdiction on the Qualla boundary. That patient would be notified, given isolation orders. We would do what we call contact tracing, where their contacts are notified. They are asked to self-monitor and stay at home as much as possible, and then that patient is monitored for symptoms to see how they're doing, and they would be asked to isolate for 14 days.
Casey, has the hospital heightened precautions recently, and can you reiterate what precautions the general public should take and be taking to stop the spread of COVID-19?
So the hospital has increased all of its efforts to prevent the spread of the virus, both in the community and in the hospital. We've implemented a lot of measures, including things that the community's seen, like external screening outside of the facility. We have set up testing sites on the exterior of the facility as well, and we've ensured that all of our relevant staff are adequately equipped and trained with their personal protective equipment. And we have a number of teams that are actually developing contingency plans as we speak. In addition to that, we would encourage the community to continue to follow the recommendations that have come from Public Health and Human Services and the tribe, and that is to maintain physical distancing, stay at home as much as possible, practice good personal hygiene, and make sure that you wash your hands. If you develop signs or symptoms or you're concerned, call the health system first. Don't come to the health system, call us first.
Okay, thank you. To date, how many people have been tested at Cherokee Indian Hospital, and can you give those results, please?
So the numbers change frequently, but as of this morning at about 9 o'clock, we had, to date, we had tested approximately 30 patients. 25 were negative. There was 1 positive, of course, and the rest are still pending.
Okay, thank you. Those are all the questions I have.
Thank you. So at this time, I just want to say to our public that the protection and security of all tribal citizens is something that I take very seriously. As everyone is aware, we have implemented sweeping orders to lessen the spread of the virus in our community, and we will continue to look for ways to keep our citizens safe. I ask our tribal citizens for your cooperation with all of the orders that are in place, and while we must remain calm, we must also be vigilant in limiting our risk of exposure. We all have a personal responsibility to each other and to our Cherokee elders. Staying home, keeping away from others, and practicing good hygiene while in public is the best means we have to keep this public health crisis from spreading. I would like to announce one modification to our security protocols. From this point forward, we will be closing access to the Qualla boundary on Highway 19 in the Birdtown community and in the Wolftown community during the curfew hours. All traffic must route through the 441 entrance to the boundary between the hours of 10 p.m. and 5 a.m. We will continue to update the Cherry community as things progress. I ask for your continued cooperation in keeping our community safe. And also, we must remain compassionate and caring, and I ask for everyone to remain calm during this time, and we will come out of this. Thank you so much. God bless you. Ski.